Hello, and welcome to today's webinar. I would now like to introduce your two speakers for today, Neil Sharma, EVP of Strategy and Partnership at Sword Health, and Ashley Bass, Doctor of Physical Therapy at Sword Health. Neil, you have the floor.
Great, thank you so much. Hopefully everybody can hear me and see me. I am coming to you from Atlanta, and want to tell you that I'm following all the COVID protocols. I have COVID today, so I'm 6 feet away from you all. I'm going to do an elbow shake with you all. Hope everybody is doing well going into their holiday and summer vacation period. So the secrets, right? The secret weapons in helping employees with musculoskeletal problems. There are a lot of things that Ashley and I are going to share with you on behalf of Sword Health. And as we go through the presentation, we ask that you take time to think about the questions. Some of them may be answered later on in the presentation, but there will be a point in time where you have Q&A. So essentially, the agenda for today is the importance of personalization. And personalization is a loaded word, so we're going to walk you through what personalization actually means, why specialized care is crucial for musculoskeletal therapy and success in recovery, picking the right solution, and also sharing with you ROI, right? What is an actual calculation? Can you give us a real example? And we're going to walk you through that. And you're going to get an actual demo from Ashley, plus we'll talk about a member experience toward the end. Then there's going to be time for Q&A. So let's jump right into it. Essentially, if we step back and look at the framework of what's happening today, we're in the midst of a pandemic, yes, but it's really a pain-demic, right? Especially when it comes to muscle and joints. The statistics tell us that half of the world suffers in some kind of pain, especially when it's related to MSK. And in the US, it's about 50%. The conservative number that you're shared is around $300 to $400 billion in healthcare costs. And when you look at that in aggregate, it's more than cancer and mental health combined. And so it is another area where we live in silence with the pain. In fact, I would be really surprised if it's not in your top 3 concerns when it comes to issues impacting employer health care. We usually see it as number 1, but I would not be surprised because we see that hockey stick movement in terms of rising medical costs when it comes to MSK. And we've also seen that 33% of all workers, especially in the compensation area, those costs are due to MSK specifically. So when we look at these numbers and we start to see the enormity of it all, it's really the tip of the iceberg because we are living in a hybrid situation. We're living in a remote situation, and we're picking up habits that are causing things to get more problematic, whether we're standing up too long in the day when we're on Zoom calls, or sitting down in a very bad posture, or not using enough time to exercise. The costs are rising, and it's exponential. And you'll see us sharing data around this. A statistic for you. The number of spine surgeries has increased in such a dramatic fashion. And our chief medical officer in SWORD did 2 studies in 2017 and 2022 in Seattle and in New York, respectively. 60% of those surgeries were not needed or unnecessary. 60%. So if you think about just one section of MSK and you see the rising costs, you also see that people are trying to get something called a quick fix. And that's what we're about to talk about today. What is another path for you all as employers to think about? The biggest problem that we see is that there's fragmentation. Now, fragmentation, we solve it in multiple ways. We try to get solutions that can talk to each other. We try to get advocacy and navigation programs. There are a number of mechanisms that we try to use to create better coordination, but the fact of the matter remains that it's highly siloed. There's discoordinated care, and we see that there are many problems in that process, that journey of that member, that cause unnecessary interventions. I would tell you, this is my first disclaimer, I worked at a navigation company for just under 3 years before I arrived at SWORD, and I basically set up the Ecosystem Partnership Program. I looked at more than 300 to 400 different solutions in different verticals. Within MSK, I looked at about 9 different solutions, and I put them through a rigor of clinical, security, business, operational audits to really find out exactly, what was strong, what was superior. I can say to you unequivocally that if the solutions you're looking at today don't have these 3 pillars, then you have a problematic solution. Therapeutic exercise has to be a core of the pillar. You have to have cognitive behavioral therapy, which really speaks to and addresses mental health concerns, and I'll explain to you why that's tied and how. And then you have to have the proper patient awareness and education. These 3 combined really help to reduce the pain and disability, increase your productivity, and basically increase your quality of life. Now, we'll show you how it directly decreases costs as well. So, the 3 pillars, and we feel very strongly about this at SWORD, and we're a very clinical-based company, and as we get into these discussion points, I'll tell you more about the company and what we do and how we do it. So personalization is very big. At SWORD, the program is regimented on creating a personal approach to every single person. Now, I want to tell you why this is a loaded word. Personalization for some solutions means to categorize you in a specific type of a pain point, and then to give you a program that's kind of a step-through program. But even within an area of disability, it's not a one-size-fits-all. In fact, everyone's pain is different. So if we look at back pain, and you have 2 individuals, based on age, based on the level of exercise, based on frequency of how well they're keeping up and treating themselves, based on location, a number of factors are driving how the recovery goes well or doesn't go well. And each of their journeys are different. So that means that personalization is really catering to them individually. Later on, when Ashley demos to you the specifics of our solution, you'll notice how in real time we are able to calibrate and provide this personalization. Again, to pause and share with you, there are solutions today in the MSK category vertical where they are not able to personalize. Some are only app-based, where they give you a video exercise to do. Once the video exercise is done, they create a report that says the person has done the exercise. No measurement, no understanding of what they actually did. Yet other solutions that will try to measure you through certain sensors or through certain video capture motion, but really can't calibrate and provide that data back to the person who's actually taking care of your care continuity. So lots of things when you look at the word personalization. On top of that, we've seen at least 1% to 2% of people who are diagnosed and don't have an MSK problem at all, right? A small percentage, but very important, because if they're misdiagnosed and they come through our program or anybody's MSK program, they'll go through that program in futility because they should have been diagnosed better. This is where I want to pause to share with you that SWORD is a very clinically driven type of a solution. It's personalized, and it has 3 different facets that are the cornerstones of our program. The first is a licensed doctor of physical therapy. The gold standard, as we all know, is a PT. If I give you an analogy, everybody flies on a plane at some point in time in their life. As they enter the plane, the first thing they look at is the cockpit. In the cockpit, they want to see a pilot. They want to see a certified pilot. Now, our hope is that that pilot has flown thousands and thousands of hours. What we don't want is a hobbyist who says, hey, I've flown remote planes and I can fly this plane. That wouldn't cut it for us. So too, when you look at MSK, and the pain and the onset for yourself or a loved one or your employees, why would you want to send them to anyone else but a licensed PT? However, a lot of solutions exist today that don't actually have licensed PTs. They have health coaches or simply coaches or nutritionists or dietitians who act in the place of a doctor or PT. At SWORD, we don't believe that. 100% of our care continuum, right, is placed in the hands of a doctor or PT. Second thing, all of our sensors and camera technology have been created to make sure that we have the proper feedback that is provided for that PT. And you'll be seeing that in a demo. The type of data that comes back is really, really important. If the data is not accurate, then you're actually going to make a misdiagnosis and you're going to provide a care that is not accurate as well. So our technology is FDA listed, and additionally, the programs that the PT comes up with are very, very tailored, right? So much so that at least 4 times in a week, if not more, it's always being calibrated. That means you may be progressing faster or slower in your therapy. And in real time, that PT is able to take you through your journey and calibrate and help you to betterment. So doctors of physical therapy, tailored treatment at every step. They have the ability to assess the member virtually. And if you think about today an actual clinic, an on-site clinic, when you go and see a PT in a clinic, on average, in an hour, they may spend about 10 to 15 minutes with you physically. Once they've given you the exercise, you may be passed on to a PTA, and they will then walk around and look at the other number of members that are there. So in a given hour, you're given your exercises briefly, and then you have to go through and do those exercises. Then you come home and do those exercises. Our doctor of PT can not only assess your challenge and your problems as you come in during the onboarding, but they're also able to monitor your performance as you go through. That information that is collected allows them to essentially engage and better your progress. So you have multiple ways of connecting with them, you have multiple ways of getting feedback, and you have multiple ways of actually figuring out your recovery. And we're there along the step. What's really interesting is our doctor of PT, and you'll find this out a little bit later as well, is also trained in our CBT program. This was developed in-house. Our cognitive behavioral therapy program is very, very well matched and mapped to our exercises because we do see a lot of challenges when it comes to mental health, and that's tied together. So that slide that I talked about, or fractional, distorted or fragmented ways of care, all of those elements, whether it's your comorbid situation, whether it's a mental health situation, whether it's somebody who's just come from surgery, they can all be tied together. So the technology is something that's been developed for several years. And unlike other sensors that you might find in the market today in the PT clinic or remotely, our technology has about 5,000 types of body movement tracking. So that means our sensors are so accurate that they can not only look at horizontal and vertical movement, they can capture side-to-side movement, they can capture an accuracy point. So if you're seeing me on the screen and I tell you that my shoulder and my elbow now are basically perpendicular and I have a 90-degree angle, I may be at 82%, right? But in actual fact, an 82-degree angle, the sensor will tell you, no, you're actually just at 89 degrees. That's how accurate it is. It's 4 times more accurate than the human eye, and in real time, it provides you feedback. So if you're doing an exercise and it's incorrect, you'll be told right there and then, hey, you have to actually redo that exercise, and this is how you have to do it better. And finally, it's tailored for your needs. It's interesting, but the data that is taken from every exercise is actually managed by the PT. And they get a dashboard, they see in real time what you're doing, how you're doing it, how many reps you're able to do, in what fashion you're able to do it. Did you get tired as you were doing the exercises? Did you need to take a break? Were the exercises too easy? were those exercises actually focusing on the area that you had that pain, and is your pain distributed? There's so many other factors that PT is able to look at based on the data that comes from the exercise. We have so much data that some of our solutions and some of our employers have a hard time keeping up with that information. We collect a lot of data, and we're really proud of it because it has to be a data-driven type of a solution. If you look at anecdotal evidence, that's not good enough to actually give you tangible evidence, and that's what we focus on. Ultimately, in this program, the whole idea is to create a DNA of education, actual motivation and guidance, and helping you focus on bringing that into your normal lifestyle, right? The goal is not to have you completely tied to a therapy for forever. It is really to get you back on what you're trying to achieve. And a lot of people have different goals. Some people just want to get back to swimming again. Some people will tell you right at the beginning that they're not able to sleep well. Some people will tell you that they just want to be able to take a hike without any pain in their knees. Whatever that focus was that led you to come and seek an MSK solution or treatment, that's what we focus on. We focus on personalizing that journey, and it's really about that whole person approach and experience. The key to all of this is that it's exceptionally complex. So it's not just about an exercise. There is a mind-body connection, and when we use our clinical-based solution, and by the way, we have multiple peer reviews and reports and data that we can provide to you all at any point in time. This allows you to see in terms of how our program is looking at that whole person and trying to address their needs. Some people actually come in and they're very depressed. By the end of their journey, they have not only gotten off their meds, but they talk about productivity and they talk about feeling better and feeling happier. In fact, on our website today, you will find many testimonials and cases around this. So the complexity of the situation is not taken lightly. In this situation, what we've realized is that you as an employer, you have to consider solutions that talk with each other, that work with each other. We are part of a customer base today that has more than 100,000 employees. They have about 12 to 14 different solutions. The solutions range from everything from something related to weight loss, to mental health, to diabetes. And there's data that is related to what we do that can be shared. We capture data based on the GAD-7 and the PHQ-9 because we do administer to try to understand if somebody is depressed or has anxiety. Additionally, we are able to share that data back to a navigation platform and or to the employer and or to other adjacent systems as long as it's BAA compliant. Additionally, we can work with people based on their BMI index. We have an accuracy in understanding that. We are not a weight loss program, but in what we do, we can show you reduction of that, but we can also work with your weight loss program in your solution and provide that information. Just one second. Excuse me. Essentially, what we find is that mental health issues, as an example, are prevalent. We have self-reports of individuals who may be suicidal in the beginning of a program, and we're able to flag that and provide the employers with that data so that they can readily be helped. Others will talk about depression and other issues because they form a bond of trust with the PT, and this is really, really important. Ultimately, what we've developed at SWORD is this program that allows for a holistic approach to behavioral health. This is not, by and large, a program that will take away from your mental health program, but this is in conjunction with your journey, with your MSK journey. So we focus on habit releasers that we have in our program called the Academy. And there's a plethora of articles and information and tools that allow people to kind of break their old patterns, break habits We also have guided meditations. And finally, we will remind you during your journey through emails and through the app in terms of how to keep yourself on track. So in terms of specialized treatments, I want to pause here and focus on something that we've done recently after almost 1.5 to 2 years of internal studies. One of the areas that we feel at SWORD we are pioneering in, we see copycats immediately forming in this area and other MSK solutions. We take this area very seriously. Pelvic health is often ignored, and those females who suffer from pelvic health issues suffer in silence. 1 in 4 women suffer from moderate to severe pelvic floor disorders. Not only that, if you look at all the different statistics we're providing here, you find that a lot of this pain occurs throughout the journey of a female. 74% of women aged between 40 and 59 experience prolapse. 1 in 3 suffer from urinary incontinence. And the sad part about all this is, if you've had a female in your life, you know certain challenges that they go through, and most suffer in silence. At SWORD, we've looked at programs and we've looked at developing programs that address this. Now, one would say it's just exercise and they'll come out with an exercise program. This is so much more. I'll give you an example. Meet Marta. Marta is the general manager of Bloom, and Bloom is this new program that addresses pelvic health disorders at SWORD. Marta has always suffered from persistent pelvic pain. She shares this openly, that for many, many years she went to several specialists. She had intense pelvic pain and painful intercourse, and she missed work. She was openly missing work, whether she had to stay home. Sometimes she had to go to the hospital. She'd understand where the pains were coming through. After 10 plus years, she was ultimately diagnosed with endometriosis, a severe form of endometriosis. And then she got into a program at SWORD for pelvic floor therapy. This allowed her to get off medication and experience pain relief for the first time in her life. She never knew that there could be specific exercises and specific methodologies related to the work that we did that could actually help her relieve the pain. So, what's unique about our program? It's very, very similar to what we do at SWORD, and then I'll tell you about the differentiation. Ashley can explain this much better, but there are PTs that are specialized in this type of care. So there are pelvic health specialists, and we have them at full-time in SWORD today. We also have, based on IP and based on the work that we've done, a biofeedback technology. This is an insertable device, and this actually allows for the PT to measure and monitor and understand exactly how the exercise is being done. Imagine if you simply have a video session and an exercise, but you actually don't know what is happening with the pelvic floor in terms of the exercise, in terms of the duration, the strength, the weakening, etc. You don't have enough feedback and data that allows you to course correct for that person. So the program is very tailored, and it's also meant to focus on giving support, almost like a community in a sense, right? So there's programs, there's resources, a lot of information that allows one to focus. The reason I put a plug in for pelvic health is SWORD covers all parts of the body. The phrase is that we cover every single body part except fingers and toes. And to develop such a clinically rigorous technology, it takes a lot. And so this is what we do. As a company, we start from clinical and then we work backwards. We're not a splashy sales and marketing company. And so therefore, you're not going to find a whole bunch of, sales and marketing type of an approach. It's very, very based on clinical rigor. In this area, to kind of, tie off, the whole idea is to improve the well-being of a person, physically, emotionally, socially, in their career, and financially. So how do you pick the right solution? And this part I have to basically tell you all that I didn't believe in SWORD in the beginning. Right? So I was working at a navigation company, and I had seen all of these different solutions. And as SWORD came into the U.S. At the height of the pandemic, so they came early in 2020, I had been looking for a number of solutions. I already had two solutions. One was an app-based solution, and was a sensor-based solution. So I was good to go. Then, as I started working with employers during the pandemic, because MSK issues started to rise, I started to notice SWORD being tested more and more by those employers that really cared about the well-being of their employees. Not a quick fix-it, right? Anybody can, if you ask for tissue paper, they'll get you a box of Kleenex, right? You never go wrong with selecting IBM. It's these phrases that you can just pick the solution that is kind of the known name and move on. But there were employers that were so desperately seeking the right measurement of care for MSK within their population that I started to see SWORD pop up over and over again. And it was because of the clinical rigor. And so that is when I started to test out SWORD, and I started to really understand if this is a solution that is a fly-by-night or something real. Well, hundreds of customers later, very successful partnerships from the largest companies like Pepsi and Danaher to small, mid-sized companies. We are very happy with the type of member journeys that we've been able to positively affect. These are the questions you have to ask. Even if you don't choose SWORD today, what is it that you have to ask so that you're not game? Because a lot of the solutions are trying to make it to sustainability. They're not a not-for-profit business, right? They're profitable business, and therefore to do that, many will try to get there, but there's a lot of cost cutting, and this can be at the detriment of your employee base. So the first question you have to ask is who supports members throughout their program? Here's where the first gaming happens, right? When you say who supports, they'll say, hey, yeah, we have PTs that'll support. Well, sometimes the PT is only during onboarding, but never through your entire journey. Sometimes they'll say a PT, but there's no way on God's green earth that the ratio actually maps. In fact, we know some solutions today that will say to you, yes, we have a PT, and yes, they're part of that program, but they'll never sign an SLA or in the contract that it's 100% supported by PTs throughout the care continuum. SWORD does, right? The ratios that some people won't share with you is like 1 in 1,300, 1 in 2,200. So that means one PT for 2,200 members that they're trying to serve. They can't do it. That's unrealistic. So that's the first question you have to ask. Second question, is care truly tailored throughout the program? As I said before, the way that this can be gamed is to put you through what is called a step-through program. So let's say I have a back pain, right? And in the initial onboarding, they realize that my back pain is not as severe, so it's not an acute problem, it's a chronic problem. So they may put me on level 3 of a 12-step program. Instead of catering and really doing specific types of exercises that will be important to me, what they do is they put me into level 3 of an exercise program that's a module. So I have to do 10 of this, 10 of that, 5 of this, 6 of that. It's already set for me, unlike our program, which is very personalized. So that's the second question that you have to ask. Third question is what technology is used and how is it used? So for SWORD, we are technology agnostic. That means we pick the very best solution that clinically provides the data we need. So at some point in time, it's sensors. At some point in time, it's video motion capture. In fact, we've been awarded finalists in many categories related to the wrist program that we developed, and that's all video motion capture. We won't put out a program until and when we really feel it's important. So here's a challenge for you. If some of you are saying, oh, I need something that is really, really simple, I just need an app. I need a phone app? You should try that phone app. I was in a trial many years ago with my navigation company and a solution I had picked, which was a phone app. And the company that we trialed with was an airline. Well, the airline hosts and hostesses gave that the worst review. I'll tell you why. You get into a hotel, the first thing you do is you have to put the phone down on the floor if you're doing back exercises. Well, as soon as you get on the floor to do the exercise, that phone can't capture your motion when you're lower. That's the first problem. Second problem, you have to stand 10 to 15 feet away from that app. Guess what? You can't see what's exactly happening on the app. That's the second problem. Third problem, the bed was in the way. The corner of the TV cabinet was in the way. So you had lots of problems trying to stand 10 to 15 feet away from this app, which is supposed to be really simple and could not capture all of your motion. So really have to understand the technology. That's really important. What is clinical validation? Most reports that you are going to get are what we achieve, like we as a solution, and then do nothing. At SWORD, we don't do that. Our base of reviews is, here is a PT. Here's the gold standard. How do we compare with an online or on-site PT? Are we able to validate that we're equal or better to what you find when you walk into a physical clinic? Most solutions don't do that. Most solutions compare to do nothing, and then, oh, this is what our solution. And you're obviously going to find some kind of improvement. So that's another question you have to ask. And finally, the savings. How are the savings actually calculated and brought about? And if they can't really explain that to you, then you've got more challenges. So I'm going to go into depth with this. This is a real company, right? They have 17,000 plan members, of which eligible adults are about 12,700, right? Of which there are about 3,700 MSK claimants. So that's the population that we've seen through the claims analysis, et cetera. But really the prevalence, because there are some people who just take over-the-counter meds and some people who just deal with their problems, the prevalence is actually 29%. So if you look at the claimants, that's about $9.1 million in spend. If you look at the prevalence overall, the addressable market is about just shy of 11 million. So how does this break down? Well, in this population, lower back is the driver, followed by knee and hip. So the three problems are always there in this instance. The breakdown is pretty clear. But you also have shoulder and neck. Now here's the funny thing. A lot of solutions will provide you a shoulder therapy when you should have actually gotten a neck regimen. There are 1 in 8 cases that SWORD sees today where somebody came in for one problem, one MSK joint problem, and it was something completely different. It could have been they came in for their left knee, and it's actually the right pelvic hip that is causing the problem. You only get diagnosed like that from a licensed physical therapist. So you see the breakdown in all of the different areas. For SWORD, we look at that and we know, after looking at the claims, the analysis, 7% of this population equals about 63% of the spend. You add the high category, and now you have 82% of that spend. So we start to target that market and that area and really start to focus on those types of individuals. The sad part is that most people, after having a nagging pain, will look at their benefits, and the quick fix is a surgery. And so you can look at the surgery percentage here. It's very sad because if you go down certain care pathways, you go to a doctor who then says, hey, my friend is a surgeon, you should really take a look at them. And then you go through imaging, and sure enough, you need surgery. There's no second opinion that could have been given to you that says, hey, you actually could have prevented that. Here are the exercises. True story. Beginning of this year, a chief strategy officer phoned me and was trying to sell me on one of his solutions. During the discussion, he kept on rubbing his shoulder. Now, this is still during pandemic time, rubbing his shoulder. And so I asked him, I said, what was wrong? He said, look, I set up a home gym and during the pandemic, and I tore my rotator cuff. My doctor said I was supposed to have surgery, and I was supposed to have surgery in December. It never worked out. So I said, look, I'm not going to buy your solution because the solution you're trying to work with sort of doesn't work, but why don't I just give you this, our pilot for free? And he's quite surprised. 3 months later, the man was standing on our stage at our sales kickoff doing a testimonial. I was shocked. He was giving a testimonial that he didn't have to do surgery, that the exercises had actually helped him, that he had wished that he had gotten a second opinion, and it was serendipitous, coincidental that day he happened to be talking to me on Zoom, and that I just happened to give him this free pilot. So I've seen firsthand when people go through our solution, just at least to understand if this is a way to prevent not just the surgery, but prevent even further problems for them later on. Ultimately, with this retailer, if you look at the surgery cost, right, we went down to $700,000, down from $1.9 million. And as you go all the way across, and I won't read it, these are all the different categories that we affected. We feel very proud of achieving that $1.5 million in estimated gross savings. So, to conclude on this section, $10.9 million, just shy of $11 million of addressable MSK spent, right, for this company, 17,000 people. Estimated gross savings, that means we enroll about 613 people in this program, and at a savings of $2,500 per member, you get a 2.5 to 1 in terms of projected ROI. How do we do it? Well, we have to make sure we're able to address that member. Our member enrollment is a kind of a limited goal, standard goal, optimal goal. Ultimately, I'm going to walk you through two solutions, right? Two talk pieces before I hand it over to Ashley. Number one is, you may have a navigation solution today that navigates and will amplify member programs. Make sure that they simply don't stack these programs. They really understand how to target and how to project. Most of the solutions know exactly how many times they have to reach out and which ways it's effective for different types of audiences. A union-based audience versus a non-union is very different. Some people read email, some people read text, some people will only look at apps. There's a number of things that happen. So we are happy to talk to you very specifically about your needs. So now I'm going to hand it off to Ashley Bass, who's going to actually lead you through the demo and member experience. Ashley?
Thank you, Neil. Nice to meet everyone. As mentioned earlier in the call, my name is Ashley Bass. I am a physical therapist by training. So really just here to highlight some of the points that Neil spoke on and really show you all our solution and demo it live for you here on the call. So really what we like to focus on here is that our PTs are the people who are really with your members at all points during their journey. And our PTs are those qualified healthcare professionals that are meant to take members through and, as Neil mentioned earlier, discern their true MSK complaints. PTs have the knowledge and background as MSK experts or musculoskeletal experts. So we're really here to do that differential diagnosis training on that initial video call and to make that tailored member experience for all their members going throughout. Now, in 1 second here, I'm going to be switching over and screen sharing from my tablet, and I'll show you our actual solution. But I briefly want to walk you through our member journey and how members enter into our program to become executors to engagers of our solution. Now, when a member finds out about the SWORD solution, it's really about the awareness of our program. So through tailored and bespoke marketing techniques, SWORD would work with your individual company to figure out what's best, how to outreach your members and engage them with our solution and let them know that we're a viable option. And once they found out about the SWORD solution, they will be provided a dedicated landing page that will take them through our enrollment process. This enrollment process ensures that their physical therapist has the best background information about that individual member to help start that process of learning about them and tailoring that member experience and care. Now, they'll fill out that form. It's a 5 to 7 minute survey. They'll fill out basic demographic information as well as information about their specific MSK complaint. And then while they're filling out that information, it triggers their kit to be sent to them. Their kit does include a standard tablet, their sensors, or any other apparatuses that they may need in order to operate our solution. So we provide everything that the member would need in order to participate, engage with our solution. The member does not need to bring their own device or any other thing that they would need. And also, if a member struggles with spotty Wi-Fi or unreliable Wi-Fi service, we do have the optionality to send mobile hotspots to members so that they can also engage in our solution and not be insecure about their Wi-Fi performance. Now, also on that enrollment process, they're going to be scheduling a call with their dedicated physical therapist. That video call lasts for about 30 minutes, and it's a video assessment. They'll deep dive into their past medical history, learn about their members' hobbies, their likes, also perform a functional movement screen on that call. So we're looking at tests and measures, how the body moves and responds to exercise. So again, that PT can really pick out that program and plan of care that's going to match up with the member's set and established goals. Once the member and PT are done with that call, the PT will then upload that initial exercise-based program for the member. And since the member has their kit, they're going to be immediately able to engage with their program. There's no waiting for them to start, no waiting for appointments, because they already have everything they need right in the comfort of their own home or whatever location they deem appropriate. They'll place on the apparatus and the straps, and they will turn the tablet on. They'll perform their exercises. They will be getting biofeedback about their movement quality and performance as they do that as well. The feedback is audio as well as visual, and so therefore really the member gets that encompassing care as they're performing their exercises. Now, not only does the member receive feedback, but the PT also receives that feedback about the member's performance as well. That arms the PT with information so that they feel like they have that knowledge base in order to adjust and modify the plan of care based on how their members are performing at each individual session. In addition to exercise-based components of our program, as Neil mentioned, we do host a plethora of educational information here. So we do have articles on pain neuroscience education. Our therapists are well-versed in cognitive behavioral techniques, as well as we do have that cognitive behavioral program that is available for all our members as well, as we're tracking that anxiety and depression scores. And then last but not least, what we find really encompasses our program and makes it that sticky program for all of our members is going to be that one-to-one relationship. So because every member has a dedicated PT, they have this high-touch environment so that member is able to have reciprocal open access communication with their PT, and that's through all standard means. That's emails, phone calls, scheduled video chats, as well as text messaging through our HIPAA-compliant chat app that is available on a member's smartphone. So all of those means of operation, whether it be from exercise to engaging with their PT, really creates that end-to-end MSK care and helps create the results that we're seeing with our program. Now I'll pause there, and I'm going to briefly switch over to the tablet, and I will show you all the solution in real time. I'm going to be screen sharing directly from the tablet that the members would receive when they enroll into our program. Now, keep in mind, our tablet is a locked interface, but you're briefly going to see a couple of applications on my screen. It's only available because I do these presentations for audiences like yourself, and I do need access to different video conference platforms. But that locked interface goes to members because A, we want them to focus on their exercises and be engaged with our program, but also we don't want the complications of having to have other applications run in the background that would minimize that biofeedback component, which we soundly stake our clinical-based claims on. Having biofeedback really provides the member with the information to perform their exercises appropriately, but also, again, arms that PT with the knowledge that while they're not there, their members are doing quality movements and not fostering any inappropriate movement-based patterns or habits. Now, I already have my sensors and straps on as dictated by the model on the screen here, and I'll demonstrate two exercises from our shoulder-based program just to give you all a snippet and sample of what our program is capable of. Now, the first step that members would go through is going to be calibration. That's simply going to ensure that my motion trackers are speaking accurately to my tablet so that I do get that real-time feedback. Now, as I mentioned before, the feedback is audio as well as visual, but I do have the sound turned off on my tablet to not have competing voices during these presentations, but I'll make sure I point out all of the key features that you're going to see on the screen so you don't miss a beat. Now, as I move my arm here, following along with the model on the screen and performing the exercises, I'm going to see that star accumulation at the top. And every new star that I achieve that's going to correspond to the range of motion available at my shoulder does have a high-pitched audible ding sound with it. So it really creates that gamification environment. It helps me strive to increase my range of motion even more. And as you can see, the last repetition I stopped midway through the range, so then I only accumulate that same amount of stars on the screen. So we're really getting that accurate real-time feedback about that movement quality and movement performance. And then at the end of every exercise, it gauges how well I'm performing as well, so I also get a snapshot of how I'm doing each exercise as well. Now, the second exercise, I'm going to get into a little bit of the meat and potatoes of how we customize our program and how that biofeedback is relevant to interpreting how members are performing and giving their therapist more information. Now here, instead of me having access to all of the 5 stars that I had in the last exercise, I am going to be limited by that red line. That red line is only going to ensure that I move just a certain point in this range of motion, and that's there because my therapist has set that confine for me. Now, this member who's doing these exercises may have chronic pain. Every time they move their shoulder to a certain point, they get sharp pain in the joint. Or maybe they've gone through the rotator cuff repair or the lumbar spine fusion, and their surgeon really wants them to limit their mobility in order to protect the surgical repair at a certain point in their rehab protocol. The PT can specifically tailor that program to fit those confines, so again, that customization piece falls in line with our programming as well. Now you'll notice that as I'm moving through these exercises, I may start to do some of these exercises incorrectly, and I'm getting that feedback delivered right to me on the screen. That helps me know that I'm compensating for things and I'm doing exercises inappropriately. So therefore, my therapist picks up on that and I'll be able to adjust the program once I look at that data and feedback. Now, if I continue to struggle and this exercise continues to be a problem for me, I can simply reach out and pause the session and I can decide to skip that exercise. But if I do skip, I'll have to place in a justification that's going to go back to my physical therapist, letting them know exactly why I've skipped that exercise. Again, feedback to the member is going to be important during our program, but feedback to the PT is also going to be very important. So in line with that, well, at the end of every program, we're going to ask about pain and fatigue levels, and they're going to be based on these pictograms that you see right here on the screen. That information clues the PT into whether the program is appropriate, whether the exercises need to be increased or more robust, or if exercises need to be removed because they're causing pain or discomfort. And then last but not least, in the member interface, we have the optionality to place in recommendations. These can be extra stretches, lifestyle tips and techniques, things that really create that overall comprehensive end-to-end MSK experience for each of our members. Things that keep them actively engaged in their lifestyle and moving so that they can get back to their normal lives. Now, I'll briefly show you all just the back-end PT portal here on the screen, and I'll just breeze through that really quickly. So I'm going to jump back to my, to my computer here, just a second, and I will screen share what the PT sees. And again, we mentioned all of that feedback that the members receive. The PT also sees that feedback as well. So here what you're looking at is a sample of our member portal. And so I have my sample member, David. Because I'm getting that feedback every time a member performs, I get to see things like compliance levels, so how actively engaged David is performing his exercises, as well as performance rating, those averages, and how many error corrective messages he received in a given session or overall based on all of the sessions here. Now, if I open up the results tab, I'll be able to see into David's specific exercise session as well as into each individual repetition that David has performed. So I'll go ahead and just briefly expand this here, and you'll be able to see what I do on a day-to-day basis. So this is every day. I open up my member management tab. I look at all of my member sessions who have performed, and I analyze and review these. And this is how I make that tailored custom experience. So here I can see correct repetitions, incorrect repetitions, but if I expand each exercise out, I get to get individual exercise data. So right off the bat, I can see error corrective feedback on the first repetition, but correct performance is here with these blue bar graphs. If I hover over each blue bar graph, I see the range of motion in a degree format, and that's what a clinician cares about when we're tracking progress in our program. So I'm able to track that at each repetition and compare that to normative ranges, which are available over here on the side. I'm also able to see chains of incorrect feedback. So this gets my clinical brain thinking, I need to go in and make some adjustments to this member's programming before they log in for their next session, which is easy enough for me to do as I click on that red tab and I load up the exercise page. I can add and remove exercises. I can adjust the sets, the repetitions, and I can even edit details here. So I'll just click around briefly so you can see that. But I can even edit these details and place in one of those range of motion limitations that you saw in the member interface. So let's lock this member's range of motion at 90 degrees because they seem to be having a little bit of pain once they get above that horizontal plane level, shoulder height level. So I'm going to stop screen sharing and we'll go back to the presentation and just wrap up briefly with some member comments and how this program is really impacting our members' lives. So here, what you have is just a quote and some things that we have here. So this quote is from Jacqueline. She was suffering from neck pain, and she said, sometimes we don't realize how much pain we're in until the pain is gone. And really what you're seeing here, she's done her sessions. I can see how many sessions she's done. She's got that NPS score rating. So we're taking that information from each member because a satisfied member is a member who's completing the program, who's engaging with our program, who's doing their exercises, and also seeing less pain and more functional activity. Now we'll go into some Q&A here, and I'll pause here and we'll jump into some questions that I have, and I already see some loaded here in the chat, so I'll just read them off. The first one lined up here is, how frequently do physical therapists at SWORD adjust the treatment plan for each member, and what would prompt an adjustment? So average, our PTs are going into members' programming again. Every time they perform a session, we're reviewing that data. And then we're adjusting programs on average between 2 and 5 times per week. Those adjustments would happen based on just some of the information that we saw there. A member struggling with exercises. A member's reporting that the exercises are too easy, so that fatigue level with the full heart or the empty heart, that's at the empty stage for 2 or 3 sessions, and so I know that that program is not giving them what they need. I go and adjust it. If I'm seeing increases of pain, conversely from the fatigue level or increased fatigue that's really detrimenting to this member's recovery, then I would go in and make those adjustments to the programming. And then the second question here, and actually tees up here, it says, how does SWORD communicate with the member? And if there are changes to the programming, how would the member know? So I think that really tees this up here. So if I do go in, and first I'll answer this, if I do go in and make changes, because I've got that one-to-one communication with all of my members, I just send a little message to them in the chat app and say, hey, I made some adjustments. I saw you were struggling, or I saw that things are getting a little bit easy. I made some adjustments. But on top of that, when a member logs into their tablet, the first thing that pops up for a session when they go in, it says, your PT has made adjustments to your program. So even if I don't get that text message or don't get that phone call off to the member, my member knows that I'm watching over their sessions, I'm reviewing their data, and I'm making the appropriate clinical decisions and adjustments to their program to progress their care and get them to their functional goals. Their goals are my goals. Now, we mentioned how does SWORD communicate. Now, I'll state this again. It's through all standard means of communication. We do have a chat app that is HIPAA compliant, so members can download our app, and then they can text with our PTs back and forth. Emails, phone calls, as well as scheduled video chats are all options for every member throughout the program, and they can have those at their whim and at any need because their PTs are available to all of our members. Now, third question that we have here, what kind of data can employers expect to receive in terms of engagement, outcomes, overall insight into how well the program is doing for their population? This is a great question. So every employer that comes on and implement SWORD would get a customer success manager, and that would be their dedicated person who's going to guide them through this experience and guide the employer through implementation and to outreach and getting this program off the ground for their employees. Now, with that customer success manager would have weekly to monthly meetings with the account, and they would be providing aggregate data. So that can include outcomes like to functional questionnaires, to anxiety and depression scores, aggregate data about decrease in pain for the overall population, enrollment data, how many members have enrolled from this date to that date, how many members have completed X amount of sessions, how many members have completed total sessions to get to the end of their program. So all of that data, very transparent data on an aggregate basis, not member level, but on an aggregate basis would be available to the employer so they can really see how SWORD is performing for their population. And then I also mentioned briefly about NPS ratings. We're asking those to all of our members as they're engaging throughout the program. And that would also be available to be shown to the employer as well, because a satisfied member is also a satisfied employer with our program and implementation process. So all of that would be available. Let's see. When you look at the employers who are getting the best results out of a program like SWORD, how are they approaching it versus how other companies might? I'm going to pitch this one over to Neil.
So thanks, Ashley. So ultimately, when you look at employers really collaborate to help us understand what type of challenges they're seeing overall in the programs, but they also allow the ability to create that touch point with members. A lot of programs today, we are able to cater to target, to specialize, and really work with employers. They see the best results, and they, hand in hand, are able to share that information, whether it's at benefit fairs, whether it's monthly updates that they have, whether it's driving certain employees to their portals to get more information. There's multiple ways, but that employer that's very collaborative, you see a lot of great results.
Awesome. And I think we have time just for maybe one more question. How do you recommend that a company evaluate MSK against other digital programs? Pitch that one also to Neil.
Sure. You can do head-to-head evaluations. You can actually take different solutions. This is very common practice today. In fact, you can have your employees enter into pilots to understand both programs. And in that way, you are very clear in the type of support you're receiving, and you're able to ask very tangible, pointed, and targeted questions related to that. We very, very highly recommend that you do evaluations of that sort, because then you can get the best results for your own employee base.